In this episode of INN CEO Talks, I'm joined by Mitch Geisler of Leveljump Healthcare, a very interesting company that you can find on the TSX Venture Exchange under the symbol JUMP. Mitch, thank you for joining me. You know, you've got a really interesting company. The name, once you start to sort of like deconstruct it, knowing what the company is about makes sense. But for somebody who doesn't know what it is that you're doing, give us an overview of the exciting area of healthcare that you're involved in.
Yeah, absolutely. Well, thanks for having me today, Stuart. Well, what we're doing here is we have a company, as you said, called Leveljump Healthcare, and we are building not just a telehealth company, but one that is focused on what we consider a core pillar of healthcare, and that is diagnostic imaging, medical imaging. When you think about what it is that is the backbone of our healthcare, so much regards around medical imaging. When you go to the emergency room department, emergency rooms, when you go to your family doctors, surgeons, any issues you have, many times you might have a CT, ultrasound, MR, X-ray, these kinds of things for modalities. And we're building a company that's based on that. And it starts out with the crux of our operations, which we've had for I've been running for over 12 years now. It's been in business for 16 years, and that is Canadian Teleradiology Services. And its core focus is on providing remote radiology services, so real telehealth before it was kind of like a big thing in the news, to hospitals and communities that are in either small urban centers or rural communities. And they don't have enough radiologists, so they use a service such as ours, like CTS, where the patients and the communities, if somebody is sick at 2 o'clock in the morning, they still need service. So they can do a medical scan there, they can take an MR or ultrasound, and then they can contact our radiologist, and we can provide a read report for them so they can proceed with patient care. So in a nutshell, we have strong operations that we've had for a long time that we want to now roll up into a national brand and branch out, not just in our emergency room service, but in acquisitions and other areas, all within the diagnostic imaging space, and bring that, if you will, to the next level, jump to the next level within diagnostic imaging and healthcare.
Okay, before we get to some of your grander plans, I want to sort of finish off filling in a few of the holes around why it's so important to have this diagnostic capability at hand when you need it, especially when you're in remote, rural, or smaller hospital centers. Without having access to a radiologist who can interpret what those x-rays are, or the CT scan is, or whatever, what does that do to the process of patient care?
Oh, well, yeah. It's a world of difference. I mean, you have to be able to have it. And, in today's society, the world we live in that is so quick and on the go, it doesn't matter where you are. So people in a small community expect, and they should, the same service that you get in a large urban center living in Toronto or Vancouver or Calgary and what have you. So these small centers, they don't have enough radiologists, doctors to read them. Before CTS comes on board, you could have a situation where patients could be in an emergency room, and if they don't think that it's utter emergency, they might send the patient home in the middle of the night and say, come back at 8 in the morning when our radiologist is here. Or they might have a ER doctor do the reading, but not the specialist, which is so important for patient care. We're talking about, some things could be simple, that you have a little accident and fall around your house, but, we're talking about people who have strokes, who have, spleens, ruptures, all kinds of medical needs. And when they're at their most vulnerable, people expect the best in patient care. So when a hospital brings on a company like CTS, brings us on, we're there as a long-term partner for them. And that's what we've seen over the years, is that we really stay on with our hospitals because we're able to assist the communities and fill that void that otherwise would exist. So we've really been able to take that to a level where these communities can depend on us.
And through CTS, you've proven that this is a viable enterprise, that it is filling a need, but you're only really just touching into that market at this point. How big is the potential market for the services that you're offering through CTS?
Yeah, well, to your first point, yeah, I think we've proven our business model. As we become public here, and we're looking for support and welcoming of the fund of the capital we've raised to help expand. But the market understood that being operational for so many years, being cash flow positive, generating cash on a monthly basis, that we've proven that the model works. As far as your question as to where we can, you know, we think as a leader, and we probably control about 5-6% of the or not control but service about 5-6% of the hospital market in Ontario alone, but we're considered one of the leaders, and we think we've primed ourselves now for a roll up throughout the country because it's a very segmented industry, if you will. It's led a lot by maybe smaller radiology groups that service hospital networks, and they don't really treat it as a business. And we're one of the first companies to really come to the market and say, hey, we can treat this like a business. There's money to be made. There's service to be provided to these needed communities. So you can really feel good about what we're doing as a company. And we really have not just the country. I mean, our immediate plans are to expand the national brand of CTS and Leveljump Healthcare throughout Canada. But because it's remote and it's teleradiology, so it's off-site radiology services, we can look to Caribbean islands, we can look to Southeast Asia, we can look to other parts of the world where they are looking for Canadian, US certified board radiologists that we can supply, and we have the infrastructure and systems to supply this. So we really think that, yeah, we're going to start with our plan here, but we have a bigger plan to go forward. We don't cap out. So the teleradiology aspect really allows us to be global, if you will, over the years as we expand.
Well, and I think that if we take a look at the doctor shortage in North America, it is not going to improve to the point where you're going to say, that'll be no problem. There'll be a radiologist in every hospital throughout the country, let alone in other countries, as you pointed out. So this becomes a vitally important link in ensuring that as we move forward, people have access to the kind of healthcare that they require.
Oh, absolutely. We are that link. And anybody. What's unique about us, a little bit different than maybe other healthcare companies, is we're not really B2C. We're not about the consumer, so to speak. Obviously, we're servicing the consumer and the communities, but we go and get our contracts. We're servicing B2B business. It's doctor to doctor relationships, and we get contracts where we signed up to become an integral partner. And like you were just saying, that help develop a core competence of growth that they can rely on and the communities can depend.
So, if that's one aspect of telehealth, you have gone and moved beyond CTS to now Jump Level Healthcare with your eye on taking on or addressing and acquiring other opportunities within that space. Tell us what you're looking at right now.
Yeah, absolutely. Yeah, in addition to extending out across the country with the emergency room service, we're looking to roll out a strategy for private clinics that also have a shortage for day service, which is a little bit unique, and we think an opportunity there. We're looking at acquisitions, a lot of different acquisition possibilities, all within diagnostic imaging, because we want to stay focused on what our core is. And what's great about these opportunities is when you look at them, they are going to be similar to our current operations insofar as they're going to be generating revenue and cash flows. They're going to be companies that are already, profitable. So, as we build, I think that's a lot that we're going to be able to offer the shareholders and the marketplace. So we're going to be looking at that. And then we're also going to be looking at technology as it relates to the diagnostic imaging space. We've already been doing some work on that, some in the sense of hardware, where we think there's unique opportunities coming to the marketplace that we want to maybe be a Canadian distribution rights holder for, that we think can change the marketplace. So that's some of it. We will look to technologies of software as well when we think it's fit. We never want to really reinvent the wheel of what's already out there. We want to be bold and find, hey, what else can we do? So part of our mandate now, we feel, as when we went to the market to raise capital and coming public now, is to find these technologies out and invest in them. So we've already started that process as well.
So, if we take a look at the healthcare market, I'm going to focus on Canada right now because that's where you're at, and it's the one that I understand the most. We have been experiencing a shortage of services that can be delivered in a timely manner for decades now, and the situation is becoming exaggerated or even tougher to get the kind of diagnostic results or feedback that a physician might require. I guess that's a long-winded way of going about how big is this market going to be based on the fact that the need for it isn't going to go away.
Yeah, the need won't. There's definitely a shortage of doctors. What's unique about us, is our turnaround time. We're known for not just our emergency room turnaround time, but even on elective studies, we turn around stuff within 24 hours and many times within 4 or 5 hours. And that's non-emergency cases where if you look at studies in all the different provinces, you'll see where wait times just to get an MR can be 30 days, 60 days, 90 days, and then the results take another 2, 3 weeks. And as far as the opportunity now, I mean, there's over like 1,000 hospitals and clinics that we've identified that we think would be ideal just for our operations. So taking out those big urban centers where we wouldn't click, and who knows, maybe down the road we change our business model that we can become part of that. But for the moment, just looking at our core competence and where we want to go, we see a lot of opportunity there for us.
So, considering the fact that the market in some ways is wide open right now, what are your impediments to being able to go out and capture those agreements with different healthcare institutions or organizations that can benefit from your service? Like you need to get from where you are now to being able to service them. What's the thing that's standing in your way from being able to say, okay, well, we can do 1,000 or more in the next couple of months?
Yeah, I think probably a couple of things that I'd look at. One, which we're doing now, is we've just recently hired director of sales, somebody who's very experienced and versed in healthcare sales because it's very specific what we do and kind of understanding software systems and how images translate. So we're going to have somebody focusing solely on building out that expansion to get to those 1,000 clients and making sure we're getting the word out in marketing. Certainly, we're using some funding from the recent financing we just had that's helping us to broaden our reach. Another thing in the past has just been particularly in Canada, sometimes you do have to go through a little bit of hoops with hospital administrators or whatever for them to buy into the idea of offsite help. However, due to the pandemic, which hasn't really, because we're that B2B that I was referring to, doctor to doctor, it's a little bit different. So we don't necessarily gain business directly from it, but we do indirectly with the pandemic because now all these administrators, hospital CEOs, other doctors, they all understand now that, hey, you've got to be able to provide your service no matter what. And they're saying if we can do it offsite, that's good because hopefully this year we're coming out of COVID and it's going to be better for everybody. But we have to keep an eye to the future, and we don't know what the future is going to hold. So there's a shift in the place right now, and that's going to really open up doors to additional telehealth, particularly in our field of this doctor to doctor kind of thing. So that would be two. And then the third one would be as us always acquiring new doctors who want to come on board and work, with the CTS model and that. So as we gain new clients, we certainly want to bring on more radiologists as well to help us expand.
Well, you touched on the COVID-19 pandemic, and I can't help but think that based on what I've heard about how that has forced the healthcare system to embrace telehealth far more robustly than it had before. It had always been a little bit reluctant to say, okay, what can this do for us? They're now saying, oh my gosh, this is making a significant difference. They're making some regulatory changes in the way in which physicians are compensated when they use telehealth that they didn't have access to before, and now suddenly the appetite for telehealth is increasing. Are you already starting to see the impact of that shift in thinking and acceptance of telehealth medicine?
Definitely starting to think about it. I mean, it's all that's on the news all the time, right? That people are talking about. There's a lot of companies providing it out there, and that's what I was alluding to before. There's this acceptance by the administrations of that, and you really hit on something important there with codes. what's interesting for us is that in the radiology business, there was actually an allotment to additional healthcare codes for teleradiology work years ago, but that wasn't common for everything. Certainly a lot of different medical disciplines have not had that, and now they have. And again, that all goes to the kind of the pot, if you will, and kind of building up this idea of, hey, it's okay if the doctor's not in the hospital, or it's okay if I'm not there right beside the doctor when this happens or that happens, right? Where possible. So it's a cultural shift. It's a very fast one. If anything, we would have said before that telehealth was moving like a snail, and now it's moving like a tornado, right? Like it's just really going quickly. But that's a good thing for us, and it's a good thing, I think, for when people are looking at companies to invest in that. And a lot of people, obviously, I think, are adding telehealth companies to their portfolio. I think it puts us in a nice space.
So you just completed a round of funding, and you've got that money to put to work towards one, helping to expand your marketing capabilities and hopefully to acquire other opportunities. How much money do you need to be able to focus in on being able to increase your client base to more than 1,000 contracts or agreements?
Yeah, well, I think actually that's another thing unique about us is because we're a company that was already generating cash flow, free cash flow, positive EBITDA. And it's been growing each year. The last 3 years, we've had 12 to 18% growth. We're projecting, organic growth with just acquiring new contracts, aside from any acquisitions, of as much as 40% this year. So we see a lot of opportunity there for this growth and to advance to the next level.
So, is your number one objective then, aside from being operational, is focusing on new opportunities to acquire?
Yeah, absolutely. We want to focus on the new opportunities, and some of it will be just expanding our existing business, and then some of it could be, acquisitions, which maybe we go back to the marketplace for additional financing or what have you. But there's certainly a lot of opportunity, and we think that the financing that you alluded to, that we cleaned up certain things on our balance sheet that we wanted to clean up. We have capital in the bank now to allocate, but at the same time, CTS can still continue growing even without touching a lot of that money. So it puts us in a kind of enviable position. So we're really comfortable with where we are. Certainly, if we go to do a big acquisition, at that point, we might go to the marketplace, but it's important to note that the companies we're looking at would be top line and bottom line beneficial to us. It would be revenue, but also generating positive cash as well.
Okay, so what's your pitch to a potential investor right at the moment who's going, okay, Mitch, I like what I hear, but why now? Why don't I wait and see how things go? What's the benefit to me of getting in now versus sitting back and watching how you do over the next 6 to 12 months?
Well, I would say this: healthcare is important, I think, for everybody's portfolio, just because it is a staple and it's not going anywhere. It's recession proof, and I don't know if we're in a recession. I don't know what we're in, but it's crazy economic times, depending on the field. But I think healthcare is always important. And I think one of the core pillars of healthcare is diagnostic imaging. I think if you're going to look at a company, you can say a company that's generating cash, a company that has year over year growth, a company that its competitors in that public space, if you're looking at buying other healthcare companies, aren't offering the service and focusing on what we are. And we're really, I call it a staple. Some brokers tell me it's like a utility, but whether it's bread and butter or your electricity, that healthcare system drives behind that. So if anything, I see us growing because we've had year over year growth. So I would say, hopefully my job as CEO is to create shareholder wealth. And if the price goes up and that, so now would be the time to invest. And because we've had so much growth over the last few years, if our revenue and EBITDA are growing, then presumably the stock price would go up. So I think that's what I would say to a shareholder. Now is the time to kind of look at our company, and do your diligence and see that we're very excited about what we're doing.
Well, one of the other things that I like about your company is I think one of your unique advantages is your IT isn't in hardware, it's in inside the brains
Yeah.
of the people who actually do the work, which is not being done by machines. And so you bring that resource of qualified radiologists to this service. It's something that prevents your competitors from getting in, and it ensures that you're not carrying enormous amounts of carrying costs on highly technical and expensive equipment.
Yes, absolutely. Everything we built up to now is like, we haven't had the expense of the brick and mortar, and why we do want to acquire some of that where it's beneficial, but we don't have like massive overheads in that. So literally our EBITDA is almost our positive cash. There's not a lot after that that has to come off. So we think that, a lot of times in healthcare, margins can be up and down. Ours is extremely consistent, and the gross margin might be a little bit smaller, but our business is very consistent, and all our clients create revenue on a daily basis. So I think that all those things kind of juxtaposition to make put us in an MBO position.
Well, I think that what you're doing is absolutely fascinating, and I'm hoping that later this year you'll come back and give us an update about not only how you're doing from an operational side, but how you're doing as far as your potential acquisitions are lining up.
Oh, absolutely. We look forward to growing the company, and I would welcome a chance to update you and everybody, all your listeners and watchers out there. Thank you very much for having me today.
Well, wonderful. Thank you, Mitch.